It's not so much reconciling, thinking that we're going to lose patients along the way. I approach all of them with sort of that classic bell-shaped curve in my head of the statistics we all learn and that we have to tell patients, but then I always think about the long end of that bell-shaped curve and that somebody has to be in there, and why not this patient? And so, I think just trying to push that envelope, and sometimes patients you think won't end up in that better half of the bell-shaped curve or in the long end of the bell-shaped curve will get there, surprisingly, and some that you think won't. And it's hard to lose patients sometimes, especially if you've taken care of them for a long time. And some of my patients have been with me for over a decade and over 15 years. I've got a few patients that I've taken care of since I did my fellowship. And, you get to know them really well. You get to know their families, and you get to watch them grow. And, I've had a couple patients that I started out with when they were in like their late teens, and now they're married with kids and all this stuff. And it's hard to lose patients you've taken care of. But it's also very gratifying to help them live their best life for however long their journey is. So whether their journey is a year or whether their journey is a decade or more, or 20 years or 30 years, or whether we cure them, because some patients we do cure them, for whatever amount of time their journey is, to help guide them through that. And frankly, it's a privilege and it's an honor. And so I don't really think about it as reconciling it. To me, it's just a privilege to be let in. And if I can help them, then I think I've done my job.